welcome everybody for today's session. Today is the first session in our English series from Carefirst. So our topic was weight management. So we have made an effort to touch all the points today. So my name is Jabeen. I'm the dietitian. We're talking about mindful portion sizes. So before I start a conversation, I just want to show you this slide. 30 years ago, if you can recall, right? How were the portion sizes for our food, right? And they were giving less calories to us, right? A 3-inch bagel, a hamburger, which gave less calories. But in contrast, now, what are the portion sizes available for us, right? We have bigger bagels, we have bigger hamburgers, and we have bigger pasta portions, which has actually add up to a caloric intake, what we do, right? What we eat on a day-to-day basis. So there's another slide for y'all to see. So 30 years ago, we had smaller portions of pop, smaller portions of fries, and smaller portions of sandwiches. But now these sizes have gradually increased, and with the increased sizes we have increased calories also, right? And this has led to weight issues and obesity, and based on Obesity Canada guidelines, which actually very brand new, released updated guidelines beginning of this month in August. Obesity is a chronic disease. Chronic disease, unlike hypertension, diabetes, high cholesterol. So obesity is also a chronic disease similar to that. So we need to treat it, prevent it relapsing, and we need to treat it in a way it is not biased and it's not stigma to anybody. And we need to validate people's experiences to make it simple, and also address the root cause. It's just not by eating less and moving more you'll be able to take care of your weight, but it's also there are a lot of issues we need to focus on. Apart from exercise and diet, there's some psychosocial issues, stress and things like that, which is related to that, stigma, bias. Those are the things we need to actually address. And these are some of the suggestions based on the evidence and research to recommend medical nutrition therapy. That is, how are you going to change your overall diet, and things like that. Physical activity, how are you going to include exercise within your lifestyle. Psychosocial interventions, basically about your other issues like how you think, and even surgery and pharmacotherapy, that is drugs, also can be used to treat obesity. So when we talk about obesity, what exactly is it? Have you guys all heard about BMI, body mass index? So this slide shows it. So body mass index is your weight in kilograms divided by your height in meters square. So if you see, there's a classification. Basically, this classification is very good for a population health approach. It's not a direct measure of your actual body fat, but it is an indicator for health risk associated with your health risk. Okay, so being overweight or underweight or obese, what is your risk factor of developing other diseases like diabetes and blood pressure and cholesterol and heart problem. So all of us might be falling in one of these categories. So based on that, our risk for health problems can be determined. So there's another thing we can take into consideration, that is called waist circumferences. Waist circumferences along with body mass index is a useful indicator actually for us to know. It gives us additional information, additional risk factors, right? So we take up to body mass index up to 34.9 to see, along with your waist circumferences, how big is your risk, right? You have less risk, increased risk, or high risk. But about 35 BMI, we don't actually consider waist circumferences. So moving along, I want to directly jump into our diet-related things like what we need to eat in order to take care of our weight. How are your portion sizes? So I'm not sure you, all of you over here are familiar with this. It's Canada's Food Guide, a new one, which is like a 1 year old, if I'm not wrong. And usually this plate, what does it tell you? It tells you half a plate of fruits and vegetables, plenty. Why? Because fruits and vegetables have higher amount of vitamins and minerals. It's packed. It is high in fiber. So these are some of the examples of fruits and vegetables with different colors, antioxidants it has. So definitely it is a very good thing to add into your diet. Okay, so the next thing on your plate is food model plate is your carbohydrate energy giving foods, which are also a quarter plate, a quarter size of your plate, but recommendations is to include more of whole grains and things like that with high fiber. So you get enough fiber in your daily diet. And the other thing on your plate is protein foods. Protein foods are usually called bodybuilding foods or repair foods, right? We need protein for bodybuilding and repair. So yogurt, milk, fish, cheese, eggs, and vegetarian form of protein, soya, tofu, and beans, all these comes under this category. And there's recommendation to eat a variety again on from this, right? So what are some of the healthy eating recommendations from Canada's Food Guide? Basically, want to make it a habit to eat a variety of foods each day. Eat plenty of fruits and vegetables, include whole grains, choose protein, limit processed food, right? Processed foods like daily meats, which are high in fat and sodium, and pre-cooked meals or frozen pre-cooked meals, and decrease amount or replace your sugary drinks with water or very low calorie drinks, right? Always use food labels to select your food, and don't get influenced by marketing of foods, right? We see a lot of ads. So basically we need to be aware of the marketing techniques. Especially we used to go out and buy fast food, right? And they used to say, oh, $1 extra, we can buy a combo, it's more cheaper, but we don't know with $1 we get a lot of calories for free, right? So being mindful and not getting influenced by the marketing messages across. Being mindful, eating, taking time to eat. I'll be talking a little bit about this, how to take time to eat and what happens, like, and notice when you're full and when you're hungry and when you're full. So sometimes when we eat, we are actually not hungry, right? That's how we end up eating more. And some people connect their foods with emotions. So that's also something you need to be mindful. Enjoy your food. So you can take your cultural food. It's not that you just have to eat fruits and vegetables, raw salads, but definitely you can enjoy your cultural food, which actually gives us a satisfaction when we eat our cultural food. And eat meals with others. Especially this is not really right now situation. We cannot eat with others other than our family members. So sharing meal is also something really important, right? So making a habit of eating. So I already gone through this. Sorry, I'll skip that slide. So healthy eating is also spacing of your meals, right? If you space your meals, what happens? You have sustained energy throughout the day, and your blood sugar levels also are pretty stable. Okay. And you might not always need snacks. And not every day you might need snack, right? So if your meal times are getting delayed, you can add some snacks to your diet. But again, what type of snack are you selecting? How are you selecting is really important. So these are some of the things you can take away from today, is putting a healthy plate into practice. When you eat or take a second helping, ask yourself, am I really hungry? Because it really takes 20 minutes for your brain to know that you're actually full. So that's why you all should have heard about it. Eating slowly is recommended. So when you eat slow, your body get cool information that it's full, it's still hungry. If you eat fast, it cannot recognize that. And if yes, what are you eating? Eat mindfully, right? So pay attention to your hunger and fullness. Balance your meal. Remember, half a plate of fruits and vegetables, quarter plate starch, quarter plate protein, and consider meal timings or snack timings. So it's really important, especially when everybody is working from home. It's really important to have your meal timings. Sometimes even myself, I am actually miss my meal timings when I work from home. When I'm at working at office, I know my lunchtime is there, my colleagues are going, it's more easy. So actually, since we have to be in this reality right now, we need to actually practice this even at home, having meals on time and eating on time. That's really important. And don't eat in front of your workstation. So you do one activity at a time, and also watch for portions, right? We spoke about portions. Best spacing for your meals is 4 to 5 hours apart. Some more tips I'll be giving you. So look into your food environment, right? Use smaller plates and bowls, pre-portion your snacks. So don't eat your snacks from your bag. Have pre-cut fruits and vegetables. I often hear from my clients saying that, oh, I buy so many fruits and vegetables, it get wasted. Actually, we had to throw. And right now, we all go less often to grocery shopping, and people buy in bulk, and it gets spoiled. So basically, pre-cutting fruits and vegetables, keeping the place where you actually are around in the house, and you can include. That's a good idea, actually. And buying fruits and vegetables which are in season. That's a great way to include fruits and vegetables in your diet. And when eating out, share or take home leftovers, right? That's what we recommended previously. Now, if you're ordering in food, order less, and share with your family, or keep half of it for your next meal and things like that. Choose high fiber foods, and also eat pleasurable foods. Some of your foods, like some of my clients say, I like little chocolate. So you can still enjoy, but again, the quantity, how much and how often you're eating, that's really, you need to think about it or rethink about it. So slowly, eat slowly, chew food well, and stay mindful. That's something which is important. And going back to my next slide, is these are the portion sizes. So we cannot measure everything, but you need to have that eye measurement for yourself. So one fist is a cup. It's like 250 ml cup. What I'm talking about is your starch. Your fruits and vegetables be as much as possible from both your hands. And your piece of meat can be size of your palm. And your oil preparation, your oil or fat in your food should be like tip of your thumb, right? These are some of the portion sizes you can put into practice. I don't want you to keep measuring, but this is something which you keep doing it, you learn. Just because I showed you the earlier slide of portion distortion, it actually, we are so used to seeing the bigger portions, we think those are normal for us, right? So we need to relearn how much to eat and things like that. So I will also recommend you to do something for yourself to see, write down what you eat or drink for at least a day. Usually I tell my clients to do it at least for 3 days and come back and we review. Nowadays there are good apps where you can go and record on your and have a digital copy. So be as accurate as possible. So you can record what you eat, how it is prepared. You can also record when you eat, what are the timings you eat your snack, when are you feeling hungry, and how much are you eating also. So an approximate figure of how much you eat, like a cup or half a cup. So when I'm talking about a cup, it's 250 ml a cup. And how much you eat, and plus why you eat, right? Are you hungry you're eating, or you're eating when just because you see some food, or there's a celebration, that's why you want to eat a little more on that day, are you bored, or things like that. You need to recognize those things. It's really going to help you think and change some of the behaviors what we're talking about when we are actually trying to control our weight and things like that. So I'm just going to leave you with this, but definitely we have weight management program in Carefirst. We'll be talking about that, and information will be sent out. There's eligibility criteria for that, and I think I'll leave it to Kenneth to let you know about it. Any questions? I'm not sure, Kenneth, we need to take it right now or at the end of the session.
I think we might have time for maybe one question. There's also going to be open mic question at the end, so we can probably take one question.
Yeah. So we have some time for one question. If anybody has any question.
I have a question, dear.
Mm-hmm.
Say, because nowadays in the commercial, they say that there are certain food that is not really healthy for the arthritis patients, and they have identified tomato as one of them. I wonder if that is an accurate information, because we used to know tomatoes are health food, but they say that it is really bad for arthritis. Now, is that true or not?
Actually, for arthritis, I know there is some misconception. There are some foods people want to avoid, not only tomato, there's other things like cabbages and things like that. Basically, there's not much of research done. There's no evidence supporting that information. So the main thing is to eat healthy, eat balanced, and do your exercise for arthritis, right? That will help, because arthritis will flare up, have a relapse, right? So yes, because there's no evidence right now, as far as I know.
Thank you, dear JP.
Okay, thank you, JP. I think we'll leave the rest of the question to the end, okay, just so we have enough time for everyone. So if you want, you can type your questions into the chat as well. We can try to get to those afterwards. Okay. So next, I'm going to be talking about the role of exercise for weight management. So just to reintroduce myself, my name is Kenneth. I'm an exercise therapist, or you can also known as a registered kinesiologist. So usually I like to start off with asking, should we exercise? Okay? And most of the time people would answer that we should. Okay? So nowadays we know there are lots of benefits to exercising. Pretty much exercise is one of the healthiest things we can do for ourselves, especially if you are not active. You are the person that can actually benefit the most from doing some physical activities. But then some people might ask, okay, I have this problem, or I have knee pain or arthritis, should I still do exercise? And my answer is usually, yes, we should. Okay, and it's actually not quite the right question to ask. Pretty much everyone should exercise unless you have some unstable medical condition. Your doctor says you should not do anything. But for most people, we should exercise. The question we need to ask ourselves is, what is appropriate for us? Okay, so sometimes we might try to work around our issues. So if you have knee pain, sometimes we can work around it by, let's say, going to the pool, for example. Or your shoulder pain, we can exercise some other ways as well. So we should exercise. We just have to find the right way to do so. But in terms of as it connects to today's topics, should we exercise for weight loss? Okay, so weight loss obviously is related to what we eat, like Jardine talked about just now, but it's also related to our activity levels as well. So the question is, let's say, which is one more important than the other? Which one should I focus on? Things like that. So the key message is that exercise by itself is actually not a good way to lose weight. And there are a couple of reasons for that. Okay, so for the first reason is that because you can actually eat a lot more calories than we can use. Okay, just for example, so let's say that we take a Tim Hortons blueberry muffin. If you look at their website, it's about 360 calories. So let's say one day we decide to eat one more muffin, okay, because we with our friends outside, we want to eat a muffin. How long would it take to use up all those calories that we just ate? Okay, so let's say we take walking example. If you walk briskly, so kind of quickly for about 20 minutes, most of the time it's only about 100 calories. Okay, so we use a lot less calories during exercise than people think. So if you eat one more muffin, you have to walk for like more than an hour to even balance itself out. Okay, so what it means that is actually really critical to manage our eating habits. So if you have limited time and energy, definitely focus more on your diet because you can definitely eat a lot more than what we can use up. So some people might ask, oh, what if I just exercise a little harder then? Okay, can I balance out my energy intake that way? So there are two kind of problems with that. So firstly, if you're someone that actually would need to lose weight, so someone that's definitely on the heavier side, you probably have some sort of joint issues like knee pain and back pain or heel pain as well. And that makes it very hard to exercise intensely enough to really use up that much calories. Okay, so that's why, once again, we need to look at our diets maybe a little more closely. Okay, and thirdly, our body actually compensates for exercise. Okay, so what do we mean by that? Okay, so we probably all experienced this before. Okay, when after we exercise, we tend to feel hungrier. We want to eat. So, from an energy balance perspective, we know exercise doesn't use that much calories, and after you exercise, you want to eat more. So that kind of balances itself out. In another perspective, after we exercise, we tend to feel more tired, so we move less the rest of the day. So that lowers the energy expenditure for the rest of the day as well. So most of it, unless you're a professional athlete, for most of us, we kind of just balance out our energy intake, so how much we eat, how much we use up in terms of calories. We tend to just balance itself out. So that's why most people's weight actually kind of stabilize or doesn't change much from week to week, because our body is pretty good at balancing it out. Okay, so that's why definitely spend more time and energy on kind of monitoring what you eat, how much you're eating, things like that. So the question is then, why exercise at all? Okay, so why do I need to exercise in weight management then? Okay, and there's actually research to show that you can actually lose weight just by managing your diet as well. Okay, but there's also research that shows there are benefits exercising if your goal is to manage your weight. Okay, so what is that benefit? The main thing is that they found that people who exercise are more successful keeping weight off. Okay, so we know weight loss is not just like a 1 week goal or 1 year ago. So it's not like we try to slim down for the summer and then we gain weight. A lot of people are trying to just actually lower their weight and actually to keep off the weight as well. And what they find is people who exercise are able to maintain their weight loss much more successfully than people who does not exercise. Okay, so why does that happen? Okay, so a couple of reasons. The main one is that our body actually slows down. Metabolism, or how much energy we use, slows down with weight loss. The reason for that, our body doesn't like change. So once you lose weight, your body says, oh no, you're kind of starving. I'm going to slow everything down a little bit. Okay, so it tries to conserve energy. And secondly, more importantly, you also lose muscles as you're losing weight. So when we try to lose weight, most people say, I want to lose fat. Okay, but our body actually would lose muscles at the same time. And after we lose muscles, our metabolism slows down as well. Okay, so that kind of makes it hard to maintain weight loss. Okay, so that's why you might have heard of weight cycling or kind of yo-yo dieting, where someone's weight kind of goes down and then it goes back up, and sometimes even goes up higher than before. Part of it is due to just not able to maintain the habits. Part of it is also due to you just lost a bunch of muscles, your body slows down, and then that kind of makes it much harder to maintain that weight loss. So exercise, especially weightlifting, helps to maintain a high metabolism. So just moving more uses up more energy. Okay, repairing and maintaining muscles also takes up more energy as well. So why is that important? Okay, so why is it important to have a high metabolism? Okay, so one of the main things is that actually help us to manage our diet. Okay, so anyone that actually tries to kind of go on a diet or lose weight before knows that it's not very comfortable to eat less. Okay, we always have like a amount that we're very comfortable eating. We've been eating like this for, let's say, 10 years or so, and suddenly to ask ourselves to eat less is actually uncomfortable. You think about food all the time, and can be quite difficult. So what exercise allows us to do is that it gives us more of a leeway. Okay, so when you exercise, we talk about exercise, we just kind of usually balance out the intake, but that's actually a good thing in a sense, because when you exercise and we have more muscles, you can now suddenly eat that muffin and not have to worry about, let's say, the interfering with the weight control so much, because we have that leeway for energy intake and output. Okay, so the higher metabolism, the more leeway we have, the more likely we are to kind of maintain that weight loss and be successful in terms of weight loss. Okay, and obviously having more muscles is also important for other things. Okay, so body function. The stronger we are, the easier it is to do anything physical. Okay, so that's why in generally speaking, it's easier for men to do physical stuff than a woman. It's easier for a younger person to do anything physical than an older person because they have that high muscle mass. And secondly, it's also to do with body image as well. So when a lot of people say, I want to look more toned, okay, or some people point to their upper arm and say, why is it so loose with age? So part of the thing is that we can need to look at like buying like a steak or like a 4-ounce steak or something. When you say to the butcher, I want like a leaner piece of meat, you talk about I want a piece of meat that has more muscle in it and less fat in it, okay? And it's the same for in terms of body image. When we say more tone, what we really mean is that I want to have more muscle inside and a little less fat inside. Okay, so that's why we actually want to keep our muscles by doing exercise and by especially weightlifting. So key thing of exercise really, or just to go anything in weight management, is that we actually want to keep muscles while losing fat. Okay, and in the picture below, you have two different persons. So one person on the left is like a bodybuilder. He or she has a lot of muscles and low fat. Okay, and he might not be weighing very little either. He can actually weigh quite a bit as well. And compared to the person on the right, who is someone who does not do exercise, same weight, same height, okay, but less muscles and definitely more fat. So for example, on the left is that the person is 5% body fat. So that person is not going to look very toned, very lean. Whereas the person on the right, even though he weighs exactly the same amounts, it's the same height, he's going to look a little bit maybe on the heavier side. Okay, so we want to maintain our muscles as we go on trying to control our caloric intake. So the question is, how should I exercise for weight management then? Okay, so usually I like to break things down into 3 levels. Okay, so we don't always have to jump to the highest level at the beginning. So first level, okay, if you don't have any exercise habit, just move more first. Okay, so we talk about exercise actually does not use that much calories. Okay, and exercise is only a small amount of time during our day as well. So for most people, they might exercise, let's say 30 minutes, an hour. If you do exercise, maybe 2 hours, but that's the only 2 hours out of the 24 hours. Okay, so the rest of the day affects our energy balance as well. So we call this non-exercise activity thermodynamics, which just means how much energy you use during the rest of the day. And they do find that people who move more during the rest of the day also maintain or are more successful at weight loss as well. So sometimes you can just tell yourself every 30 minutes, get up, move a little bit. Nowadays, if there's something like an Apple Watch or something like that, that could be a good reminder as well. But moving more during the rest of the day helps as well, and that's a good place to start. Just sit a little less for the day. Secondly, so once you're able to move a little more, then it's actually important to have like a structured weight training routine, especially if you are trying to lower your caloric intake through diet. Okay, so we talk about as you lose weight, you tend to lose muscle as well. So it's important to keep that. Okay, and that requires weightlifting. Okay, so just eating more meat doesn't necessarily help. We actually have to lift weights. And sometimes exercise doesn't help it directly as well. We actually have to lift weights. We actually have to challenge our muscles to keep those muscles. Okay, so how much do we need to lift? We need to do somewhat challenging weight. So I'm not going to go into detail this time. Okay, but just think of you need to lift weight, and you have to lift like weight that's slightly challenging for yourself. Okay, and thirdly, if you still have the time, if you still have the energy, okay, then you can add the aerobic exercise on top of that. So aerobic exercise is anything that gets your heart pumping a little longer, faster, get your breathing a little faster, and something that gets sustained for a longer period of time. So let's say brisk walking, swimming, biking, that sort of thing. So if you have the time and energy, you can add some aerobic exercise that tends to use more calories, okay, so that can help with the weight loss as well. But the most important thing is more is not always better. Okay, so a couple of reasons. First one, suffering is not sustainable, meaning If you don't like it, you're not going to continue it, and that is not a habit you can continue. Your weight loss is not going to stick either. Okay, so whatever you try to, any method we try to use to change our weight, we actually have to sort of at least not hate it, because if you hate it, you're not going to be able to maintain it, and after you go back to your previous lifestyle, your weight is going to rebound as well. Okay, so we need to find something that we can enjoy. Secondly, aerobic exercise, we know that if you do too much, your body also adjusts as well. So people who does tons and tons of aerobic exercise, they generally speaking, they move less during the day, okay, because they are so tired. So that's why more is not always better. But if you have the time and energy, definitely you can add on top of it in terms of your exercise routine. Okay, so as a summary, exercise is definitely good for our health, but it's not a good way to lose weight by itself. We definitely need to have the nutrition part and diet down. We're going to pay more attention to that. However, exercise is very important for long-term weight change. Okay, so the research has found that people who exercise more are more likely to keep weight off. Okay, and exercise just by itself is good for your health as well. So we should exercise regardless if we're losing weight or not. And a key part of exercise in terms of weight management is really keeping muscle mass and also maintaining a high metabolism. Okay, so we want to keep our muscles because it's good for us, it helps, and then also we want to exercise because it gives us more leeway, a buffer for what we can eat. Okay, so we don't have to restrict, even if you balance it out. But if you exercise more, you can eat a little more, and you feel more satisfied. You're more likely to be able to maintain that habit change. Okay. So in terms of priority, okay, so in terms of levels, so first thing, if you don't have any exercise habits, okay, just move more during the day, it's a little bit less to start with. Okay, if you can manage that, okay, maybe think about trying to learn how to lift weights safely, okay, and have a structured routine where you actually do try to build up and maintain your muscles. Okay, and thirdly, if you definitely still have more energy, you still have time, you can add a little bit of rope exercise, which does help with kind of speeding up the weight loss a little bit. Okay, so before I open up the question, I'm going to just answer the most frequent question. Okay, so the first question people ask is, how do I lose fatty fat? How do I lose my stomach weight? Oops, sorry. So the first thing is the short answer, manage your diet. Really is, the short answer is you cannot really lose weight from one area. You do have to lose weight from the entire body. So really, as you lose weight, you're going to lose fat from your stomach as well. Okay, so you definitely manage your diet. If you're looking for that kind of lean, kind of six-pack look, you do have to do some ab isolation exercise, so exercise that targets specifically abs, like things like crunches, sit-ups, things like that. So that's the short answer. Okay, so the long answer is why can I not just lose weight from one part of the body? So they actually done a couple of different research on this topic. Okay, so one topic that kind of showed this concept is that they look at athletes. So let's talk about, let's say, a badminton player or any sports that's one-sided, so they use mostly one side. So if we can actually lose weight from one part of the body, what you should see is that you should see like athletes, the dominant side should have less fat than the non-dominant side. If you can actually lose weight from one side by using more of that side. Okay, but what they find is that there's no difference. Okay, so what they find is that the athlete's dominant side, they have more muscles inside. So let's say that if you're right-handed, the right side has more muscle, but the amount of fat is no different than the amount of fat on your weaker side. Okay, that kind of demonstrates that you cannot just use fat on one side of the body by working the muscles around it. Okay, but there is one study that shows there's kind of a way that might work. So what they find is that if you use muscles in one area, that tends to increase the blood flow to the area, and that helps you release energy, fat from storage. Okay, but just releasing it doesn't work. You actually have to use it up as well. So one thing they did find that if you kind of do some kind of ab exercise and then go for a walk, that tends to help with losing belly fat. Okay, so if you really want to try something, you really want to just try something specific, you can try that. So do some ab exercises, okay, and afterwards do some just light to moderate intensity aerobic exercise, So the idea is, once again, we increase the blood flow to your stomach area. That helps you release the fat, and then we're to use it up by kind of going through aerobic exercise for let's say 10 minutes at a time. Okay. So I think I have time for one question. Okay, so maybe I'll open the floor up to one. I'm going to see the chat. I'm going to just look at chat first. Okay, can you give, so Peter Chow asked, can you give some information about weight training programs, any websites? Nowadays there's a lot of different resources online. I can send out, let me look, so this, because there's so many, I can find something that's useful and I'll send it out to everyone afterwards through email. Okay, so I think I have time for one more question. Okay, so if anybody want to ask.
Can I ask a question about the intensity of the exercise?
Sure.
Yes. So we know that there's a maximum target heart rate.
Yeah.
And according to your age and so on.
Sure. Yeah.
So if after every exercise, say you reach, say, 80% or 85%,
sure. Yeah.
Would that be okay?
That depends on your age. For most, if you don't have any medical conditions, so 85, anything about 80 is considered more vigorous, intense exercise. So not everyone can tolerate vigorous, intense exercise. So if you use exercise, then that's okay as well. Okay, so if you don't have any heart conditions, vigorous exercise you can, but at the same time you don't have to push yourself to that intensity either. So we know kind of 60 to 80% is good enough to make your body change. Okay.
Yes, the reason is that I'm following some exercise class, and every time when I measure the heart rate, it is about 80 to 85%, but I'm feeling okay, so that would be fine, right?
Yeah. Especially if you have any questions, just definitely talk to your doctor specifically for this. Okay, no problem. So right now I'm going to pass the time to Ray, our social worker, and she's going to talk more about the kind of emotional side of weight change as well. Okay, so I'll pass it back to you, Ray.
Can you guys hear me? Yes?
Yes, we can hear you.
Okay, good. Hi, everyone. My name is Ray. I am one of the social workers with Carefirst Family House team. Many people tell me that they have issues with emotional eating. So if this sounds familiar to you, this is great. I'm going to spend next couple of minutes to share with you what I have learned about this topic. Okay, it's probably just a little bit over 2 o'clock. Did you just eat? And why have you chosen this time to eat? People say, I may eat at 12, I may eat at 1. Think back to the last thing you ate. Do you remember? Who did you eat with? And also, where did you eat? Okay. People might say, yes, because I eat because I'm hungry, because I haven't been eating since this morning. I know some of my colleagues would say, I choose to eat at 1 o'clock because I can eat with other colleagues, certainly keep safe distance, right? I use the time to socialize with other colleagues. Okay, and also think about, why do we eat? And what are the different reasons that we eat? Most people will say, yes, I eat because I'm hungry, my body needs food. And yes, food does provide us energy that our body needs to keep going. We all know that without food, a person would typically not able to survive for a few weeks. Water, maybe just a few days, we can't survive, right? We eat because we're hungry. But apart from physical hunger, stomach hunger, we're going to talk a little bit more after that. There are several other reasons why people eat. For example, we eat together with family to celebrate birthdays, holidays, or retirements, graduations, and we eat when we are happy. And also we eat because we're not happy, sad, maybe some other reasons, right? But the main reason is we eat because we are hungry, right? And usually we talk about stomach hunger or physical hunger. This is when you feel the hunger pains. By seeing hunger pains, think about if you're really hungry, how your body tells you. What are the symptoms you notice? For example, people are telling me, if I'm really hungry, I feel a little bit tired or lightheaded or even headache, right? This is your body is actually telling you it's physically ready to eat. And the food is necessary for the ongoing functions. So when we talk about hunger in weight management program, we're actually talking about stomach hunger or physical hunger. Okay, sorry. Sometimes we do have some other type of hungers that can be mistaken for stomach hunger. For example, mouse hunger. Sorry, it's just the sensors off. Mouse hunger, for example, is when we crave for a specific food, especially when our senses have been stimulated by a specific environment, or such as place, smell, sight. For example, if you just had a celebrating lunch with your family, and your children or grandchildren will say, yeah, let's go watch a movie. I know the movie theater now is open. So you just drove together to the movie theater. When you went in, what did you see? I was talking about before, I'm not sure about now, the cinema, if the popcorn, you know, is open or not, but before the COVID, if you go to the movie theater, you probably will see people holding bags of popcorns. You smell the popcorn smell, sweet, cheesy, and you see people happily eating popcorn. You hear the popcorn machine making popping sounds. So you suddenly, you want to eat some popcorns, and also your children, grandchildren ask for popcorns, right? That is called mouth hunger. Why? Because you just ate, you're not physically hungry, and you only want that one type of food, okay? There's another type of hunger, it's called head hunger. That is when you eat in response to certain rules you probably learned. For example, I grew up in a large family at that time, you know, we were really poor. And there's a table rule, it's called, you have to finish everything on your plate. Okay, on the dinner table, we have to finish everything we eat. So it's not hard at all at that time. But now I still having that kind of rules in my mind until I realized, oh, that is something I learned when I was young. Okay, I always finish everything on my plate. So I do develop some strategies. For example, I'm not going to scoop a lot of food on the plate because I know I have to finish it, right? There's another type of hunger, is called emotional hunger. Okay, I'm going to spend a little bit more time, hopefully. Yeah, I still have a few minutes. So we all have different emotions, and we don't always eat just to satisfy physical hunger. Many of us also turn to food for comfort, for stress relief, and also we reward ourselves with food. Okay, so when we do, we tend to reach for certain food, for example, sweets, something with special texture like chips, crunchy. Those food called kind of comfort food, but usually those are not really healthy food, right? So emotional eating basically is we use food to make ourselves feel better and to fill our emotional needs rather than our stomach. Okay, so emotional eating can actually distract us from understanding what we really need. And so people might ask, yeah, then how do I know I have other needs to be met? How do I know if it is not stomach hunger, right? A very simple strategy, but highly effective, is called a stop approach. Okay, that means before you eat, I want to eat something. So before you eat, especially before you eat unplanned meal, because if you eat breakfast, lunch, dinner, and 3 o'clock, suddenly I want to eat, right? Those unplanned meal or snacks, or before you go in for second helpings, try to ask yourself, am I hungry? Okay, when we talk about hungry here in the weight management program, it's again is talking about stomach hunger. That's the true physiological drive for us to eat food, right? Our body needs it. So at that time, you ask yourself, am I hungry? Then turn into your body to feel, do I have the hunger pains? Do I feel a little bit tired, stomach ache, stomach rumbling, you know? And think about when did I eat? Have I eaten hours ago? Okay, if you know you haven't been eating for a while and you experience those hunger pains, so that's stomach hunger. So yes, go eat. So if you know you just ate recently, that's not stomach hunger, then ask yourself, what's going on? Do I have the blast? Blast, basically the capital letter for different emotions. Like, do I feel bored? Do I feel lonely, anxious? Am I angry, or am I happy or sad? Or do I just simply have a craving, right? It's normal to feel cravings. We all have times we feel cravings, right? But we want to relate to it more mindfully. By seeing mindfully, we know we don't experience physical hunger. We just have a craving, okay? If you know you have a craving, you have a choice. Okay, by seeing choice means instead of mindlessly to grab a full bar of chocolate, you can choose just to eat a piece of it, right? And to satisfy yourself. Okay, or instead of eating the whole donut mindlessly, and you can choose just to have a bite to satisfy you, and or eat half of it. And same thing with chocolate. Instead of finishing the whole bowl of ice cream, you can choose just have a spoonful of ice cream just to satisfy you, right? Another helpful strategy is, Jabin just mentioned it, is called mindfully eating, mindful eating. In the program, we will talk a little bit more about it, but because of timing, I'm not going to say anything about it. So physical hunger and emotional hunger may be easily confused, okay? But there are some key differences between these two. So basically pay attention to how and when your hunger starts, as well as how you feel after eating. Because physical hunger usually builds gradually, and your desire for a variety of food, but not just one typical or a few typical food. It occurs several hours after a meal. It also go away when you eat. You feel full, you're satisfied, and after eating, you feel a sense of satisfaction. And emotional hunger usually develops suddenly, unrelated to time. It's after eating, you probably feel guilt, and because you're overeating, you feel shame. For a weight management program, we mainly adopt the vitality approach. It is an integrated approach that basically promotes healthy eating, active living, and positive self and body image. So it encourages individuals to make healthy choices and promote environment that make healthy choices easier. So in this program, Jabin is going to talk about eating well, and Ken will be talking about being active. My part is mainly focused on feeling good about yourself. Okay, we will spend a little bit more time talking about recognizing triggers in terms of emotional eating, and trying to find some strategies. And also we'll talk a lot more about mindfulness eating. And skills area, we focus on self-assessment to help you understand yourself a little bit better, understand your needs a little bit better. And we will also work with you, set up your personal goals, developing a change plan. It's all about self-management, and certainly talking about self-esteem, self-talk as well. We all know that there are many factors that affect our health, like activity level, like chronic disease, stress, sleep, smoking. Yeah, that's a lot of other things. during this program, we will talk a lot more about the factors that you have control over rather than you don't. Okay, and we will be discussing specific strategies that you can actually use to reach your personal health goal. And that's the overall goal of the weight management program. I'm going to end here so that people have a little bit more time to asking the questions. I'm going to pass it back to Kenneth.
Okay, so maybe we can have one question for Ray first, and then we're going to go to the questions in the chat. Okay, so if anyone has a question for Ray.
Or if you have a question for Kenneth and Jabin, that's fine.
Okay, so maybe we can go to the chat first, okay, because so the first question is for Jabin. Okay, and the question is from Didi. Many people do the 12-hour, 14-hour, or 16-hour fasting. They seem to lose weight. What is the drawback of this?
Definitely these are not sustainable long Jen. You can use it under a medical supervision or under a supervision of a healthcare provider, a person who is more accustomed to that. You can do it for some time until you reach your goals. There are some studies saying that intermittent fasting helps, and there are some studies showing keto diet helps. But again, after you achieve your goals, when you go back to your regular eating habit, right, that's where the problem comes in. So to sustain some habits, change slowly, gradually, you need some medical advice, some expert opinion. So that's why I recommend. And some of my clients actually, they do half of intermittent fasting, half of keto, and they try to do so many things in one stretch, and actually that's where the problem comes in. So you'd be really careful about what you're doing, and do it under somebody's guidance. That will be really great. And if you have big weight loss goals, yeah, then definitely. But again, it's not one factor, as we discussed about with our obesity guidelines, right? It's exercise, diet, emotions. Sometimes we need medication therapy, things like that. So it's everything.
Okay, second question. I actually see two questions from Joyce. I'm going to just pick one of them. So the question is ab exercise only for men? So ab exercise can be for both sexes. We're built very similarly. Okay, the only issue is for women, especially if you have childbirth, natural childbirth, or if you have some pelvic muscles dysfunction. Ab exercise, because it increases the pressure in your abdominals, it can lead to some leaking issues. So in that case, you might need to see some like a special physiotherapist to work on your pelvic muscles control. But generally speaking, exercise can be for both men and women. Next question from Ab Talmud. Okay, is recreational cycling or walking, which one is preferable for seniors? So both is fine. Okay, so if you have balance issue, sometimes stationary biking can be safer. So we know if you have really poor balance, brisk walking is not recommended because that can lead to falls. But generally speaking, both is fine. If you have knee issues, sometimes cycling can be more comfortable, whichever is more comfortable for you. Next question, let's see. Okay, I think that's all. Actually, next one is Richard Tamaki. Okay, hi Kenneth, how do I know what heart rate should I be aiming for exercise? Okay, so the easiest way is to do the talk test. Okay, so we just need moderate intensity exercise. Okay, so the talk test, you take a breath in, count out loud in a normal speaking voice, the pace. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so that was in one breath. So if you can count to, let's say 10 to 15, that's kind of light intensity exercise. If you can count around 5 to 10, that's moderate intensity exercise. So that's roughly where you want to aim for. Okay, so vigorous, if you can choose to do it. But for most people, if you can count to 5 to 10, that's a good benchmark. Next question from Alice Lam. What is BCI? So that was from one of the slides in my talk. BCI is body composition, which just means how much fat relative to how much muscles you have.
I think that's a question about weight management program. They want to get some more information.
Okay. Jabin, do you want to, Ray or Jabin, do you want to explain what a weight management program is?
Yeah, so Kenneth, you all can add in if I'm missing on something. So our weight management program we're running for past 2 to 3 years. We used to have initially 8 sessions, but we saw participants were not able to commit to all 8 sessions. So we actually revamped our program. It's for 4 sessions, but definitely there's a criteria. Not everybody we can join, definitely. So there's a criteria. So we'll send a link. There's a criteria of body mass index about 27 to join in. Once you are able to register with your number and details, actually we'll contact you. The link will be available on the website with the flyer in few days. Our first session starts in October. So I think, and we'll have sessions with myself, Kenneth, and Ray, all 3 of us. So we'll try to be as simple and more information in 4 sessions and see how it goes. Like, yeah, definitely.
Okay, thank you, Jabin. Okay, I think we just have 2 more questions, and then we can have like open mic questions. So the first one is from Rose May Lee Chong. Within a few weeks, doing some stretch exercise and a good diet, how much weight would one lose? Okay, Jabin, you can maybe jump in for this as well. So generally speaking, kind of a sustainable weight loss is about half a pound to a pound a week. Is a good target to aim for. We know if you lose weight too quickly, that's usually not sustainable. That's usually not very comfortable either. So kind of half a pound to a pound per week is what's kind of recommended.
He's asking about stretching exercises. So basically, we mostly cardiac is what we recommend, right? Like for weight loss.
For weightlifting, and then add cardio if you have time energy.
So yeah, light weightlifting.
Yeah.
And a good diet again depends what is your activity level. Are you sitting and working, or you're just working physically active at work as well? And what is your calorie consumption? Are you including all type of foods, and what are the portion sizes? So good diet is basically very broad. Yeah, balanced diet and things like that. Yeah, it's 0. Is the same amount, 0.5 to 1 pound per week.
Okay. Next question from Donna. How much exercise is called enough in a day? Short answer is just whatever you're happy with doing for the rest of your life. So something you can sustain. Okay, so that's the short answer. A question for Ray from Winnie. How to stop craving even if I'm aware I eat because of stress?
Okay, I think it's really great you aware that you have the craving and you are aware that you eat because of stress. So I would suggest you start from stress management. You might be able to work with a therapist or even find some information online in terms of stress management. I'm pretty sure if you're able to manage your stress well, you'll probably made aware of your eating, reduce the portion and gradually, you know, instead, as I said, instead of eating a whole bowl, instead of a spoonful, and gradually you will reduce it. Thank you.
Okay. So right now I'm going to launch a poll. So while if you can help us to fill it out, that would be great. So while you're filling it out, if you have any questions, you can also shout it out, and then we can try to answer while we're completing this. Okay, so if there are no questions, I'm just going to remind everyone that we have a talk next week as well. The topic is going to be done by our guest speaker is going to be occupational therapist from Mackenzie Health Hospital, talking about stroke. So if you want to join, you can use the same link as before. If you ideally everyone, if you can register for a flyer, that'd be great, so we can see have everyone's email list. If you use someone else's link, it gets a little confusing on the participant list because I see multiple people with the same name. So if you can all register, that'll be great. Yeah, but if you have all registered, the access link is exactly the same. So I'm going to send a reminder confirmation next week as well, but it's the same link as today's.
Thank you, Candice. I have to go now. So
Okay.
bye for now.
Okay, so thank you everyone for joining. Hopefully see everyone next week as well.
Yes, thank you everyone.